Good morning, and thanks for joining us today. I'm Carlos Phillips, Greenville Chamber President and CEO. We host these Community Matters discussions to connect you with local, state, and national leaders. You can find past recordings as well as the upcoming Community Matters schedule at greenvillechamber.org. Before we get too deep into the program, I want to share a couple of housekeeping items with you. Please turn off your cameras and mute your microphones. And you can submit questions through the chat feature. We have a lot to talk about today, but we do want today's program to be interactive. Now to our speakers. Today, we're talking about something on the top of everyone's mind. No, not the Electoral College, but the vaccine. And to guide us through this important discussion, we're joined by three experts. Dr. Brannon Traxler, South Carolina Department of Health and Environmental Control, Interim Public Health Director. Dr. Saria, Saccocio, Prisma Health's Ambulatory Chief Medical Officer and leader of their COVID-19 Vaccination Task Force. And Nathan Ash, Secours Mercy Health's Vice President of Pharmacy, Acute Care. I want to welcome each of you all to today's Community Matters. Dr. Traxler, I'm going to address this first question to you. Let's frame up the conversation with an update from you on the status of the state of South Carolina right now. And I'm also going to ask if you could drill down to the Greenville County level at any opportunity. That would be great as well. Where are we with COVID cases? And can you provide a broad overview of where we stand with the vaccine?
Sure, and thank you for having me today, Carlos. And it's nice always to be involved in something involving my hometown with Greenville. We are seeing cases increase. We have been seeing this since shortly before Thanksgiving, but especially since Thanksgiving, have really seen an increase in cases statewide. It was along with seeing an increase in hospitalizations and seeing deaths in large numbers, unfortunately. This mirrors what we had been seeing in other parts of the country. We were a little delayed compared to some areas in the Midwest and upper Midwest in regards to seeing these increases, but that's likely due to the fact that it's nice and warm here for longer. And so people weren't gathering indoors as much. Looking at Greenville County specifically, it has seen the largest numbers of new cases of any county in the state during that time frame. Greenville is right now experiencing large numbers of cases. The highest number, I think, occurred back right at about a week ago on December 9th, but it is still remaining high. The percent positivity that we look at in terms of the percentage of people who get tested that are positive has increased in Greenville County as well. It's been running for the last 2 weeks at a little over 25% for Greenville County. That's compared to about 20% at the state level. I will say one good thing is that Greenvillians are getting tested. I think there have been over 19,000 people tested in Greenville in the last 2 weeks using a molecular test. And so I want to continue to encourage people to make use of the testing events that we have. Our partners at both Mercy, Secours, and Prisma Health have, as well as others that are available in Greenville County. You know, the vaccine is certainly a hope that's out there on the horizon, I think, that we can see, and it's not even really necessarily on the horizon anymore. It's at our doorsteps for those first doses. The FDA gave an emergency use authorization for the first vaccine last Friday, and the CDC provided recommendations for its use over the weekend. And the first doses started arriving everywhere in the country, including in South Carolina yesterday. And places will continue to receive those first doses yesterday, today, and tomorrow. We expect this first week's amount to be just a little under, I think, 43,000 doses for the state. We're looking to get probably 200 to 300,000 total doses in the state before the end of December. And this week there'll be that just under 43,000 will be going to about 56 different sites in the state. This initial phase that's called phase 1A is targeting the healthcare providers that are out there on the front lines, as well as our long-term care facility residents and staff. The main goal is to prevent death. And so we're looking at the most at risk, who are also the most critical to preventing death. And our vaccine advisory committee for the state has provided guidance along with the CDC on that those populations would be the initial ones. It'll continue to be rolled out. The phases are still being determined for phase 1B and 2, and eventually all of us in the general population will be eligible in phase 3. And we anticipate, based on the numbers that we're hearing from the federal government, that it'll be available, this summer at some point for anybody who wants it. And I certainly would encourage anybody, when it's your turn, when it's your phase, go and get it. But until then, we're asking everybody to step up by stepping back and allowing these frontline heroes in these at-risk populations to get vaccinated first.
Yeah. Dr. Traxler, thank you for that overview. And I appreciate you recognizing our folks on the front lines who have been working with COVID patients at significant risk to their own health over the past few months. So thank you for recognizing them. So is it a fair statement to say that the availability of the vaccine, it's a big deal?
Certainly, it is a big deal because we have limited doses here at the beginning. It is a big deal, though, that there are doses available. It is a big deal for this vaccine to be given an emergency use authorization and to be able to be arriving in states literally less than a year after this virus was first identified in the genetic sequence determined. That really is a modern medical and scientific miracle, I would say. But it is still in limited doses and quantities at first. And while we expect that number to continue to increase, it may not be at the pace that some folks want, but I promise everybody will get their turn.
Good. That's good to know. Thank you for that overview, Dr. Traxler. I recently I read a New York Times story that included a survey that you answer a few questions and it told you where you are in line for the vaccine. And I was so happy when I took the survey that I was 11th in line for the survey. And this was a line of about 75 people, if you will. I was 11th. I was so excited about that. I thought about auctioning my place in line off to the highest bidder until you threatened me with SLED. And so I'm reconsidering that strategy. But what are some of the factors that go into determining one's place in line, if you will, for that vaccine?
Sure. And yes, we ask that people please only get vaccinated when it is your turn, but do get it when it's your turn. So I'd encourage you not to sell it off to others. But certainly, so as I said, the biggest overriding goal is to prevent death from COVID-19. And so the CDC's Advisory Committee on Immunization Practices puts out guidance for who should be in each phase. And then our Vaccine Advisory Committee in South Carolina, which is made up of about 24 different stakeholders representing all the different populations and communities in the state, takes that guidance and looks at it and adjusts it as needed and applies it to South Carolina and what fits for South Carolina. In this phase 1A, it is looking at the people who are at the most risk and who also are the most critical to saving lives. So certainly most critical to saving lives, and to a large degree also at risk, are those frontline healthcare workers who I agree are absolute heroes in this. In addition, the people most at risk are the residents and staff in long-term care facilities. We know that over 40% of the deaths are attributed to residing in a long-term care facility. So Those are the first, two. As they go on, they will continue looking at preventing death, and certainly it also keeping society functioning as they look at groups of workers and essential workers. But the main goal is going to be looking at risk factors and who's at the most risk as well of exposure as well as of severe disease if they get it, and of maintaining our normal routine to the extent possible.
Got it. Thank you. So there is a clearly defined distribution plan for the vaccine.
There is a clearly defined phase 1A right now, and it is
Okay.
available on our DHEC website. If you go to scdhec.gov/COVID-19 vaccine, then it'll have the phase 1A guidance. The CDC's Advisory Committee on Immunization Practices has not yet voted on their 1B recommendations, nor further. We have some very draft, preliminary kind of sketched out lists of who might be in those categories. But that is still so subject to change that it's not something that's, that we have in print and such. I think that the CDC has said that the next groups that they will be looking at in no particular order, really are essential workers and people who have risk factors for severe disease. And like I said, by phase 3, all of us will be able to get it.
All right. Good. Good to hear. Good to hear that plan, phase 1 is in action, and subsequent phases are being developed. Nathan, speaking of the Center for Disease Control, the CDC, who the heck is the CDC? Can we trust the CDC? So 2 softball questions there for you about CDC, just because there seems to be varying levels of trust, if you will, in the CDC right now. So who are they and why are they so important?
Yeah, thanks for the question. We can absolutely trust the CDC and the FDA. I think one of the things that you've seen play out over the last 5 days, a lot in the news, is that they have very public meetings. The information is shared very publicly. They give time for public comments. And they do a great job of making sure that these decisions, whether it's allocation recommendations or clinical recommendations, are vetted in the public setting. And we can all take confidence in that process. And when it comes to vaccine, the CDC's role is, once it's authorized by the FDA in this case, they look at the information and they make recommendations on how who we provide the vaccine to. And then also any of the considerations, such as monitoring how long we monitor after a patient or employee receives the vaccine, things like that. So there is really a partnership between the CDC and the FDA when it comes to vaccinations. And we're seeing this process play out in a very public way, but this is the same process we've used for vaccines. It's just, when it was shingles vaccine, it didn't get the press that this vaccine obviously is getting. But I think we can take confidence that the process hasn't changed, and it's, as it's been playing out, it's very public and very transparent.
All right. Thank you for that, Nathan. Now, trusting the CDC is one thing. There's also, I think, an opportunity to build trust in the vaccine. Many people, some from specific communities, are a little leery about taking the vaccine. I've heard from childhood about the Tuskegee experiment and how that has built some mistrust in the process and in medications and what have you. But how much should we trust the vaccine?
So I would say that those events that have occurred in the past, like Tuskegee and such, Henrietta Lacks, others, are real, and we we can't ignore them, and we have to acknowledge that they happened, and that there can be real hesitancy, which is completely justifiable. I will say that all of those unfortunate events, though, in history have led to the extensive process of review that vaccines and medications go through now. So that is why we have all of the basically checks and balances, is how I think of it, in the process, of many of which are independent from the FDA even, or the CDC. So it gets reviewed by so many different groups. It gets reviewed publicly, is very transparent, as Nathan was saying. And so, so the whole protocols that everything has to go through now are a result. So thankfully, there were lessons learned from those unfortunate events, to make sure that they aren't happening again. So I do think we can, every population can trust this vaccine.
Good. That's good to know. As I saw the vaccine being administered yesterday, of course, it was all over, television and everything, and I saw folks receiving the vaccine. This is going to sound kind of weird, but I grew excited about the vaccine as well, and I anxiously await my own opportunity to take the vaccine. It's going to be a game changer, and I think it's in everyone's best interest to take the vaccine when their number is called. All right, Dr. Saccocio, what does the vaccine rollout look like at the local level? We've seen and heard a lot of information nationally about the vaccine and distribution, but what specifics can you share about the vaccine rollout at the local level?
Sure. Well, first, Carlos, thank you again. And like the others on the call, we're so grateful to be able to connect with our community, because it's due to people like yourself, Carlos, as a leader in our communities, and particularly one of our business leaders, that we continue to build that trust and the transparency of why it's so very important for everyone who has access to this vaccine to get the vaccine. This is what will make the difference for us in 2021, protecting our communities, keep people safe, and building business again. So I appreciate your leadership and those who have joined this call today. As we look locally in the state of South Carolina, and particularly the Prisma Health markets, within the hour, we will be giving our first vaccine, is our hope. We are expecting to meet the truck at the gate and open up our Christmas presents, the treasure that has arrived. We are thrilled. So today is the day, and we can't wait to get this shot in the arms of our healthcare workers, those who have been frontline. I'll share with you that thanks to DHEC's support and generosity, our ask was for nearly 10,000 vaccines to start, and we were indeed approved for nearly 10,000 vaccines to be spread across the Prisma Health market to reach communities, again, starting with our healthcare workers, as we recognize that's important. And that includes everyone who takes care of those patients. And we heard from Dr. Traxler just a moment ago that Tier 1A Phase 1A rather, had been approved. We'll continue to walk that line. Of course, there are many people who are standing up to be first, and we appreciate that so much. And we also are gracious for those who recognize that those who are first need to be first. So that being said, being able to offer 10,000 vaccines right out of the gate, the first week that we receive it for our 30,000 team members, I think sends a message that the state of South Carolina is not taking a back seat, that they have done a tremendous job through the leadership of DHEC and our federal government to ensure that South Carolinians are in line, just like everyone else across the country, to receive this important vaccine. So we are starting with our Phase 1A. There's almost a Phase 1A, the very first, in the middle, and then those at the end of Phase 1A, all very important, but are individuals and team members who work in the emergency department. Those nurses, respiratory therapists, food nutrition, environmental services that are at the front line in our COVID units, our critical care units, those who are standing in line all day long testing patients in our drive-through testing sites. We are following the guidelines and the recommendations from DHEC, recognizing we're going to do Phase 1A first, and then we'll focus on the others. We are, of course, around the hour and by minute receiving requests, and people are asking questions. When am I next? And we sent out a batch to over 2,000 team members to sign up to get their appointment. As of course, we're following the VAM system. That's the Vaccine Administration Monitoring System that CDC is requiring to have in place. And of course, this is for safety purposes. While we have a very safe and effective vaccine available, it's also a new vaccine. So the CDC is doing an excellent job of ensuring that we can track and report any symptoms, how many vaccines are being delivered, who are they going to, how are we crossing the US to ensure first people are first and the vaccine is safe. So first and foremost, safety comes first, and those who are closest to those individuals with COVID, those who are at greatest risk and most vulnerable is where we're focusing now.
All right. Thank you for that, Dr. Saccocio. As you can imagine, we have several questions in the chat feature, and so we're gonna transition over to those. And the first question I'll ask is, how will individuals know that it is their time to receive the vaccine? Will they get a text message? How will they know that it's their time?
So we will be communicating each phase as we go along. As each one is finalized, we will be shouting it from the rooftops. So we have multiple methods of media that we use, really any kind, from social media to print to radio, TV, and as well as community events like this, making sure the local leaders are informed. And so a lot of it will come to you from probably multiple sources. So it'll be hard to miss. But, I really encourage people to stay up to date, continue checking that scdhec.gov/COVID-19 vaccine website. It's got a lot of really good information on it, frequently asked questions, and it'll always have the most up-to-date information about which phase we're in and the guidance and which populations are part of that phase.
Got it. Good. Don't know if you can answer this question or not, but when do we anticipate reaching, I think the term is herd immunity here in South Carolina, when enough people have taken the vaccine that we can start to feel pretty, confident that we're over this thing?
Certainly. So in terms of when we're over it, we'll be monitoring the cases. We will continue monitoring cases and doing case investigations and contact tracing down to every single one, and even monitoring for quite some time after the last case. In terms of reaching that point of immunity where the virus should not be getting spread around in the community, we need to look at 70 to 75% of the population being vaccinated. And so that's why we really call on everyone when it is their turn to please be vaccinated. This is a vaccine that can be trusted. It does look very effective and very safe. And that is going to be the key to us being able to get back to normal or close to normal, is going to be enough people taking the vaccine. So we'll need pretty large numbers.
Thank you. I remember it was just recently that I visited a Walgreens location and received the flu vaccine. Quick and painless, although I have an aversion to needles, the flu vaccine was quick and painless. Will retailers like CVS and Walgreens, will they be a distribution channel, if you will, for this COVID-19 vaccine?
So we are working with many partners, including a lot of the pharmacies, to make it available, like I said, especially when it is out there for the public, but even before then potentially, but to make sure that there are multiple places and multiple ways that people can get vaccinated. And so that includes working with various pharmacies.
All right. Good. Next question. What are some of the documented side effects from taking the vaccine? How can we expect to feel soon after taking the vaccine?
Well, sure, I can start and others can add in, but I think it's mostly typical of what we see vaccines. So headache, fatigue, we see some fevers. And I think it's important to note that in the studies with the vaccine, we've seen mostly those adverse events occur after the second dose. Based on reports, they've mostly been very transient. So mostly resolved within 12 to 24 hours. But I think we should acknowledge that they can occur and make sure that we think about that as we start to vaccinate employees. One of the things that we're doing within our hospital, I'm sure every hospital is thinking about this, is we're not going to vaccinate all the nurses on one particular unit at the same time, and just thinking through in case they do have adverse effects, we want to space that out. So as we've had discussions with our business partners across our organization, we've started to have those conversations with them as well about staggering certain types of employees to think through that. But I think the adverse effects that we've seen so far over, we have about 2 months worth of data, has been what we would expect. And again, mostly after the second dose and mostly transient in nature. But we certainly want to be transparent about that and prepare people.
All right. Thank you for sharing that, Nathan. And while you have the mic, wanted to ask you a question. Dr. Saccocio mentioned the Prisma Health allocation for the vaccine. I think it was close to 10,000. But we have a question about Secours and how many local doses that you will have available in this first run.
So very initially, we're going to have a very small amount, similar to other hospitals across the country. Each hospital's allocation is pretty small in this first week of distribution. So we would expect probably around 1,000 doses. And then, we do expect Pfizer will be able to ship more in the coming weeks. The other exciting news this week is Thursday, we'll start the process that we went through last week with Pfizer, with Moderna. So we expect the FDA to release more information about the Moderna vaccine today, and then we'll start going through that. They'll have their very public advisory committee meeting on Thursday. We expect shortly thereafter, they'll make a decision whether to authorize the vaccine, and then we'll see the CDC's advisory committee that we spoke to earlier. They'll be meeting over the weekend again. And so we should have a very similar process. And that's really important to have both products authorized, because that'll give us that much more product through the allocation process to receive and then vaccinate.
All right. Thank you. Thank you for that explanation. Dr. Traxler, for you, will the vaccine protect us against, will it prevent the spread of the disease?
So in terms of the spread of the virus, what this vaccine has been proven to do so far is to prevent symptomatic illness, basically to prevent the people from getting sick from being infected. There are still studies ongoing in terms of whether it actually, or what impact it has on stopping the spread of the virus, but it does protect people from getting sick from the virus.
So we could still get the virus, we just won't feel the side effects.
Potentially, that's still being studied.
I see. Okay. All right. We're going to continue to go down the questions here.
Carlos, I can take the question about the Pfizer versus Moderna, at least here locally
Okay,
in the
thank you.
upstate.
Thank
We
you.
have been informed by DHEC that for at least the first 48 to 60 days, the Pfizer vaccine will be what we are using. And there are many reasons for that. For one, this is also a 2-dose series vaccine. You'll receive your first, and 21 days later, there'll be a 4-day window. So some will maybe get it 17 days, but within 21 days, that second booster will be given. And we anticipate an appropriate immune response will be received at approximately 28 days. So after you get that second dose, and this is why it's critical to receive both, it will take 7 to 14 days for an adequate immune response to develop and mount. It's also important because of that 2-dose series that we start with one vaccine and continue at least consistently with one to ensure that those who have received the first dose get the second dose of the same. Because here's the other piece of information that's important. Once you start with one vaccine, you need to stick with one vaccine. This is where our studies lie. This is where the research is. And so we're trying to follow that information very closely. So again, Prisma Health will have Pfizer to start. We anticipate over time, as we heard from Nathan, that Moderna will roll out behind it, which requires that second dose at 28 days versus 21 days. Of course, they're both relatively the same in efficacy. What we're seeing from the early research is 94 to 95% effective, which is phenomenal. I think this is really important to remember, but don't just stop at one. You've got to get both vaccines. So I see Dr. Traxler nodding her head as well, and that's something that we'll continue to profess. The CDC has also, again, using its VAM system, created an opportunity through VSafe. So V as in vaccine -safe, that when you get that first vaccine, you'll get a request to sign up for this service. It'll check in with you to see if you've had any symptoms. It starts off daily and then moves to weekly, and it will send reminders through text or via other options of connecting so that we don't forget to get that second vaccine. So that's the only way we'll be successful with this. We heard already about herd immunity, how important that is, and truly to gain true herd immunity, you got to get those 2 vaccines.
Thank you for sharing that. Does the patient get to decide which vaccine they take? I mean, how is that decision made? I mean, could I choose between, well, I would rather take the Pfizer versus the Moderna, or is that decision made for me?
So right now, when there are limited quantities of the vaccines, it will probably be decided for you in the sense that where you're getting vaccinated or the group that you're getting vaccinated in, has been allocated one or the other. As Dr. Saccocio said, their efficacy is basically identical. Their safety is the same. The big difference is that 1 week difference, the 7 days between, when you get your first and second dose. It's just a little bit further apart from the Moderna one. I will tell you that in my mind, they're the same. I would take either one of them when it's my turn, whichever is offered to me. There are other vaccines that are in the pipelines too, that are still being studied and researched that over time could come out as well. One of them even is a 1-dose vaccine. But I agree with Dr. Saccocio that right now, the ones that are available, it's, there's not data to show that you have immunity after 1 dose. So it's really critical. And you will get reminders from DHEC, from VAMS, from multiple places, probably from the entity that vaccinated you, but really reminding you and encouraging you to do that second dose.
Thank you. I was going to ask you about kind of the pipeline. I heard that there were some single-dose vaccines that are in the pipeline, but it's probably not best to wait for the single-dose vaccine if your number's called.
Right. When it's your turn, please, whichever vaccine is out there and is available, it's not going to be a vaccine that's being used if it hasn't met those rigorous standards of the FDA and CDC. So whichever vaccine you're offered first, I strongly encourage you to take.
Because we see that there are a number of vaccines that are being tested and trialed. So if you're hedging on one, there's no guarantee that that one individual designated vaccine will be available. We're going to trust the science, and whether it has emergency use authorization and ultimately final FDA approval, that's where my buck stops.
Gotcha. Gotcha. Can any of you all share, or is it important for us as patients or citizens to know what's in the vaccine? That's not been anything that's really interested me. I just want to know, does it work? But
Sure.
you know, how available, how public are the contents of the vaccine, and how important should that be for us?
So I think that that how important it is probably an individual choice. But understanding that again, they all go through this rigorous review that not only looks at the data in terms of whether it's effective and whether it's safe, but does review. I mean, they may review the manufacturing even to make sure that the manufacturing of it is being well done and safe. They review the ingredients and such. But there are very detailed ingredient lists on the FDA's website for any vaccine that's got an emergency use authorization. I suspect they're also available on the manufacturer's website, but the FDA also makes it very transparent and puts it on theirs.
Gotcha.
Yeah, the other thing I would add, and just to build on previous comments, is, you know, one of the things we hear a lot about is this is the first commercially available mRNA vaccine. But I think a really important point, in addition to, you know, I agree that the ingredients are on the FDA website and be knowledgeable about that. But as community leaders, I think it's important that we also acknowledge and share that the science behind the vaccine has been going on for decades. So it's not as if the science was stood up in January and we started this process. This science has been building back into the 80s and 90s. And we're to a point now where it could be used to develop the vaccine. So while it will be the first commercially available, and we should be honest about that, we should also acknowledge that the science has been building to this point.
All right. Thank you for adding that, Nathan. So speaking of the contents of the vaccine, I've seen stories that if you have certain health conditions, perhaps you should wait or be concerned about taking the vaccine. So for example, I have a shellfish allergy. If I get the phone call a week from now to take the vaccine, should I be concerned about that? Would I be able to take the vaccine? How does that work?
So the only really contraindications, the only reasons why somebody shouldn't take the vaccine, the biggest ones are if you have an allergy to one of the specific components. However, from what I read, I don't believe shellfish is one that's a concern with this vaccine. But you could, if anybody has questions, I mean, certainly talk to your provider about it. However, if you do have a history of anaphylaxis, like your throat swelling and stuff like that, if you're carrying the EpiPen, you just might want to make sure that wherever you get vaccinated is somewhere that can provide care to you on the off random, small chance that you did have an allergic reaction.
All right. And we had a few questions in the chat about that. People with high risk immunocompromised conditions, things like that. And by the way, I got to tell you, I love participating in this call because I'm hearing terms, learning terms for which I am unfamiliar, and I'm learning quite a bit. I'm learning quite a bit today. So so glad we're having this call. We are almost 45 minutes into today's call. We've got a ton of questions that are in the chat. And what we'll do is we'll collect those questions, send those out to you, and ask you to answer them so that we can circulate those back out to circulate those responses back out to the public. So I appreciate that. If you had some closing thoughts that you wanted to share with the folks on this call and anyone who may review or listen to this in the future, if you have some closing thoughts for them, what would they be about the vaccine?
I think I would start with, I think as as leaders within our communities, I think we have a responsibility to share information, point people to the FDA and CDC's website. For those who are active on social media, you've seen the stories. And there's a lot of misinformation and some disinformation out there. And I think we want informed community members to make decisions when they're deciding whether they want the vaccine, if they're going to wait, or if they're not going to get it. We want them armed and informed with the right information so they can make a good decision for them and their family. And that would be my biggest message to this group is to really encourage people to seek out information that is quality and that they can trust.
And I would share two things. I think that's excellent, Nathan. Thank you. And I'll build upon that. As we provide that information, be prepared to receive this vaccine in unique environments and places where you hadn't received it in the past. Of course, you can expect it in clinical sites, so with your primary care provider available, but also expect to see mobile units traveling in neighborhoods, going to schools. Be prepared for drive-through testing sites to offer this vaccine, much like we tried with our flu vaccine this year. Get it when you can get it, as we heard from Dr. Traxler. I think that's really important. But here's the piece that I think is so critical and most important at this point. Please wear your mask. Socially distance. Wash your hands. We got a long way to go before we even get close to having everyone vaccinated with 2 doses of this very important vaccine. We are struggling in our hospitals with staffing and beds available. We heard this already. Hospitalizations are going up. Deaths are going up. This is serious. And in the holidays, please, I encourage you not to gather in groups, even small groups of people outside of your family household put you and others at risk, as well as holiday gatherings. And we're so excited to get back to social living. I completely understand, and I struggle with the same. Those social connections are vital to the social fabric of our communities, but hold tight. Let's pause. Let's take this time to do what we need to do to keep everyone safe so that we're all around to receive this vaccine and celebrate in 2021.
And I agree. I couldn't have said it better than both Nathan and Dr. Saccocio. Step up by stepping back right now. Be patient. Wait your turn. But when it is your turn, step up and roll up your sleeve and get vaccinated and really be the community leaders that you all are. Both as Nathan said, by sharing factual information and correct information, but also by it may be that you let your constituents know that you got vaccinated. I don't know, you share a photo or you just you send out a tweet. People are going to be looking to their community leaders, and so there will be eyes on you. And so I encourage you to step up when it is your turn. And lastly, Dr. Saccocio is right. The case counts right now, and especially in South Carolina and especially in Greenville County, are very concerning. And you heard from her about how it is in the hospitals. And so we're facing Christmas. I know we all want to gather with family. We all want to gather with friends and do our normal things, but it's just not safe this year. And so I really encourage you, avoid group gatherings with other households and make sure you're wearing a mask anytime you're out and about and around people outside your household, so that we can all be here together to celebrate then the holidays in 2021. So thanks.
Yeah, well stated by you, Dr. Traxler, Nathan, and Dr. Saccocio. I want to thank you for joining us today and sharing this important information about the vaccine. There is certainly light at the end of the tunnel. If we do the things that we're supposed to do in the coming months, then we will return to some level of normalcy, particularly where we can reconnect with folks in a more personal way. So again, thank you for sharing information today. I also want to thank again our essential workers. And there are a lot of folks that can be classified as essential workers right now, from folks who working directly in the healthcare space, even our teachers, and folks like that who are risking it all on the front line to help us navigate navigate this pandemic. But again, thank you all for joining us on today's show. A recording of today's show will be shared on the Greenville Chamber's website and sent to attendees along with a survey. And I want to encourage you to complete that survey because it does inform future Community Matters programming. We take the time at the end of every call to remind everyone to please do your part in helping to stop the spread of the coronavirus. As Dr. Traxler mentioned at the beginning of today's show, our cases are still on the rise. And we can influence that trajectory. We can influence it in a positive direction by continuing to mask, by continuing to wash our hands, and continuing to social distance. Those are three activities that are simply stated. Oftentimes it seems as though they're much more challenging to execute, but we've got to bear down. Now is not the time to remove our foot from the pedal. We've got to be disciplined. We've got to be diligent. And even though a vaccine is being distributed right now, we've got to continue to engage in these healthy activities to ensure that we are safe and that we are healthy. Again, thanks to everyone for joining us today. This is our last Community Matters of the year. So I want to take the opportunity to wish everyone a very happy and safe Christmas and holiday season. Everyone take care.